What is the principal muscle involved in horizontal adduction of humerus? A. Rhomboids. B. Pectoralis major. C. Posterior deltoid. D. B. Gastrocnemius. What is a typical adaptation to a regular cardiorespiratory workout program? A. Decreased resting heart rate. B. Increased resting diastolic blood pressure. C. Increased number of type IIB muscle fibers. D. Decreased mitochondrial density of type I muscle fiber. Which is recommended during the concentric portion of a resistance training exercise for a participant doing 8 to 10 repetitions each set? A. Inhalation. B. Exhalation. C. Breath holding. D. Valsalva maneuver. Which resistance training exercise primarily uses the sagittal plane of motion? A. Leg extension machine. B. Dumbbell shoulder press. C. Chest press machine. D. Standing hip abduction using a cable column. Which exercise is most appropriate for a client who has muscular imbalances in the upper cross syndrome? A. Seated narrow row. B. Chest press machine. C. Dumbbell shoulder shrew. D. Shoulder internal rotation using a cable column. Which fitness assessment methodology effectively measures a client's muscular strength? A. Push-up test. B. YMCA bench press endurance test. C. 1 repetition maximum squat test. D. Body weight squat screen. What important process of motivational interviewing is addressed first to assist a prospective client? Overcome ambivalence over regular physical activity. A. Evoking. B. Planning. C. Focusing. D. Engaging. Which statement describes an outcome-oriented goal? A. I will decrease my caloric intake by 300 calories per day. B. I will reduce my body weight by 10 pounds over the next 2 months. C. I will perform 90 minutes of moderate intensity aerobic exercise each week. D. I will complete a minimum of 3 cardiorespiratory training sessions each week. Which method is most appropriate for monitoring the activity intensity of a client with hypertension? Who takes a beta blocker prescribed by a medical professional? A. Target heart rate established as a % of heart rate reserve. B. Rating of perceived exertion using the category ratio scale. C. Heart rate monitor pre-programmed with the client's target heart rate. D. Target heart rate established as a % of age predicted maximal heart rate. What resistance training exercise incorporates both concentric and eccentric phases against a fixed external load? A. Isokinetic. B. Isotonic. C. Isocaloric. D. Isometric. When doing standing hip abduction utilizing a cable column, which adjustment will reduce? What torque is given to the hip joint? A. Position the ankle strap closer to the ankle. B. Select a heavier weight on the cable column. C. Raise the ankle strap closer to the knee. D. Step further away from the cable column. When do carbs serve as the principal source of fuel during an aerobic capacity assessment? A. Throughout the entire test. B. in the last 2 minutes of the test. C. After reaching the first ventilatory threshold. D. After reaching the second ventilatory threshold. All of these are characteristics of rapport, other from A. Short duration, B. Exhibiting empathy, C. Demonstrating warmth and genuineness, D. Creating impressions of professionalism. Which of these tests measures cardiovascular fitness? A. Leg press test. B. Bench press test. C. Bodyweight squat test. D. Rockport fitness walking test. A client can rotate 30 degrees during a thoracic spine mobility screen. Which areas could be directly impacted? A. Occipital joint. B. Iliotibial band. C. Lumbar spine. D. Subtalar joint. Which method of measuring body fat is erroneous when used on obese clients? A. Hydrostatic weighing. B. Skin fold measurement. C. Bioelectrical impedance analysis. D. Total body electrical conductivity. Which muscles are likely to be tense when a posterior pelvic tilt is identified? A. Quadriceps and anterior tibialis. B. Gluteus maximus and gluteus medius. C. Rectus abdominis and hamstrings. D. Hip flexors and erector spinae. What is the most usually palpated spot while testing a client's heart rate? A. Tibial artery. B. Jugular vein. C. Femoral artery. D. Radial artery. What units of measurement should we use to compute BMI? A. Height, m. Weight, kg. B. Height, in, weight, pound. C. Weight, kg, height, m. D. Weight, pound, height, in. What is the best way to deal with pain or any underlying diseases if a client reports lower back pain from a certain movement? A. Screen for pronation or supination. B. Improve mobility through the ankle and hips. C. Refer out to a qualified healthcare professional. D. Strengthen the rectus abdominis to correct the length-tension relationship. Miranda is 15 minutes late to her session. The trainer wraps up the training on time rather than extending them for the 15 minutes Susie was late. Which behavioral change principle will allow Miranda to understand the consequences of her tardiness and correct it in the future? A. Shaping. B. Operant conditioning. C. Observational learning. D. Cognitions of behavior. Why would the gluteal prime mover become asleep during hip extension, allowing the hamstrings to take over as the primary mover? A. Co-contraction. B. Reciprocal inhibition. C. Synergistic dominance. D. Hypertonicity. Are you passionate about fitness and helping others achieve their health goals? Have you ever considered becoming a certified personal trainer? Earning a personal trainer certificate is not just about gaining credentials, it's an opportunity to inspire, motivate, and transform lives. Whether you're looking to pursue a career in the fitness industry or simply enhance your own workout knowledge, obtaining a personal trainer certificate can open doors to endless possibilities.